I'm Alison Singer with the Autism Science Foundation, and I'm here now with Dr. Brian Freedman from the Center for Autism and Related Disorders at the Kennedy Krieger Institute. Dr. Freedman, thanks so much for joining us today.
You're welcome, Alison.
You have a very interesting new study out that looks at the divorce rate among parents of children with autism. Can you tell us a little bit about your study?
Sure. Our study showed that parents of children with autism actually tended to, it appears to stay together about 64% of the time. So in 64% of the children with autism that were surveyed through the large national survey that was used, 64% of those children were in fact living in married, biological, or adoptive homes.
So that's then a 36% divorce rate versus the 80%. Where did that 80% number come from?
So just to step back a second, so the 36% is in fact not only divorced families, it also includes single parent families as well as families who are separated, as well as other groups, families who are children who are, for example, living with grandparents. So in fact the divorce rate is actually, it would seem smaller than 36%, although unfortunately we didn't have access to the data to give us that exact number.
And how does that compare to the divorce rate among families who don't have children with autism?
In our study, we found actually no differences between between the rate at which children with autism and children without autism actually were living in homes with their married biological or adoptive parents. The marriage rate among children without autism was about 65%.
We hear often that the divorce rate for typical couples is around 50%, and yet in your study, the divorce rate among typical couples was lower. Can you talk a little bit about that and what you saw in the data? Sure.
So our focus in the data was more so on children with autism. So that certainly came to our mind as well. I know there's been there have been some recent examinations. There was an article in Time last week actually that talked about that perhaps we're not taking the best look at divorce rates, and in fact that once you start to take into account different variables like the employment levels as well as education of the parents, divorce rates actually seem to change. Within our study, we controlled for all of these different variables. So we controlled for demographic factors like age of the child, poverty levels, as well as race and gender. We also controlled for maternal characteristics, so physical health and mental health. And after controlling for all of these different variables, we in fact still found no differences between children with autism and children without autism.
We know that families who are raising children with autism experience a significant amount of stress.
Absolutely.
Can you talk about what this study found in terms of stress?
So unfortunately, we didn't have the opportunity to look at stress within this study, although the literature is very clear on the fact that parents of children with autism oftentimes experience a significantly difficult time, many times more difficult or more stressful at least than parents of typical developing children as well as parents of children with other disabilities. In addition to that, we know that many parents of children with autism also face marital challenges, so marital satisfaction oftentimes is found to be lower among these families. Our research suggests that many of these families, despite all of this, are in fact resilient and finding ways to stay together.
I think a lot of parents have really responded to this because in addition to the stress of knowing that your child is going to have so many significant challenges, being confronted with that 80% divorce rate, I know, added a lot of stress. So do you think this is going to be a net stress reducer in terms of how families are going to face the diagnosis of autism?
That's certainly our hope. And our hope is that other professionals start to cite this statistic as well. We know that in the past, professionals haven't really had good information to provide to families, and so they've looked at whatever information was available to them, which up until now was an 80% divorce rate. So our hope is that by giving this new information to families, that we will in fact be able to help some of them have some hope about their relationship. The families will no longer effectively have a diagnosis of autism and then a diagnosis of divorce.
So what's next for you and the members of your lab?
So next for us is first and foremost to replicate these results. So we want to take a look at other sample sets. The research is not so great in this area, and so we want to identify some other data sets that will allow us to look at other families of children with autism to see if we find similar findings, and our hope is that we do. Next is for us to understand these families from a longitudinal perspective and incorporate components like parenting stress and marital satisfaction and coping, because as you said, we know that so many families do exhibit increased parenting-related stress as well as lower marital satisfaction. So we want to understand the impact on these families over the course of time of having a child with autism, and then start to look at how some families are able to be more successful. So we know that some families, for some families, having a child with autism increases the extent to which they become a kind of tight-knit family, and the family kind of bonds together. So they're able to tackle the challenges they're faced with parenting a child with autism. Our hope is to understand what some of those families are doing that are helping them to be successful, and then identify and translate those support mechanisms so we can provide them to families that are less successful.
Well, we wish you the best of luck with that research. Thanks so much for being with us today.
Thank you.